Thursday is Veterans Day, a legal holiday since the 1920s, a day when the United States pauses to honor those who served in the military. But there are holes in the services meant to materially provide for and protect those veterans. Amanda Vinicky joins us now with more. Amanda.
Yes, Brandis, it has been a year of turmoil and change at the Illinois Department of Veterans Affairs, with former director and former state representative Linda Chapalivia resigning in January after allegations of systemic mismanagement of the COVID-19 pandemic that contributed to an outbreak at the state-run veteran home in LaSalle. 36 residents at that home died in the outbreak, and an audit by a state watchdog came to this conclusion. Our investigation determined that the Illinois Department of Veterans Affairs' lack of COVID-19 preparation contributed to the scope of the outbreak at the home. In addition, failures in communication at the home and within the IDVA leadership contributed to a delayed response to the outbreak. Now, a new acting director was brought on in April, and he told a state legislative committee today that the situation has improved, with LaSalle passing a federal inspection.
IDVA has exceeded CDC and DPH guidance with our testing programs, and to date, we've conducted over 120,000 COVID tests. Almost double that in rapid antigen tests through our facilities. And because of the unique mission and the pure dedication of our employees, IDVA enjoys the highest overall average of staff vaccination of all state agencies at 88%.
It's 99%, by the way, of residents of those veterans' homes vaccination. Now, Acting Director Prince says that he took a triage approach to get immediate needs at the agency under control and is moving forward now with strategic plans, hiring someone in a long vacant position to oversee the state's 5 veterans' homes. Also, a women's veterans coordinator has been hired, and establishing infection control programs, including technology he is looking to bring, like video monitoring at these homes. Now, but there are challenges. Lawmakers heard that veterans' homes are at only about half capacity, with 560 beds filled of about 1,000 spaces available. Prince said that COVID has slowed matters because admissions must be halted anytime there is a COVID case at a home. But he says mainly it is a staffing issue that is causing families to wait to get a loved one into one of these homes.
Told you earlier, staffing, ladies and gentlemen, is a tremendous issue for all organizations, whether it's at the state veterans home or going to get your local get a coffee at your local coffee shop. All organizations are facing staffing challenges that have been unseen in years. The Great Resignation, as it's been called, has caused us to look at it from an aspect of, do we have enough nurses on staff to provide the 2.5 hour plus care? And we don't want to be the average. We want to be above average. We want to be providing 4 hours of care per resident per day.
Prince says, as those who served in Vietnam age, he predicts a tidal wave of veterans needing higher levels of services, and also communicating how to access those available services like federal VA healthcare, another challenge.
The veterans are not proactively being educated or informed about their healthcare benefits, or think that they are not eligible. Just yesterday, I enrolled a female veteran in VA healthcare who was discharged from the Army in January and has gone without any form of healthcare since then, despite having a brain tumor. That example is a weekly occurrence in offices like mine throughout the state of Illinois, whose job it is to help veterans access their benefits.
State Representative Camille Lilly says that she's concerned about inequities that is, of care for Black and Brown veterans. She's advocating for more veteran service officers in communities where veterans reside. She wants at least one in each state Senate district, but that proposal has stalled.
I have an annual lunch brunch for our veterans during this wonderful week, thanking them for their services. And they tell me each time, these are veterans, they do not feel supported. They do not get the services that they need, and they do not know where to go.
Other areas of concern include combating high rates of veteran suicide and helping veterans to access and afford dental care. Meanwhile, the state is moving forward with $270 million of rehab and reconstruction of the veterans home in Quincy following outbreaks of Legionnaire's disease there. Also, Acting Director Prince several times told lawmakers that the long under construction 6th veterans home, and that will be in Chicago, should be opening, he says, soon. Brandis, back to you.
Amanda, thank you.